Again, type 2, this is the most common, may be treated with diet, exercise, medications, and insulin, but not required to be treated with insulin. This is the form that can be controlled. People can reduce their blood sugars with therapeutic lifestyle changes. Then we also have gestational diabetes. This only occurs in females because it only occurs during pregnancy. We'll talk more about gestational diabetes and life cycle nutrition in upcoming classes. But basically, what happens here with gestational diabetes is around the 24th, 26th week of pregnancy, the placenta kicks out some stress hormones, and it's actually physiologically fascinating how it all occurs. And I get geeked out just thinking about it. But in an effort to get energy to the fetus, mom's cells become a little glucose intolerant. And that means that more glucose is in the blood, mainlining into the child for fuel. So physiologically, it's a beautiful situation, but for some women, we see too much elevation of blood sugar, too much insulin resistance, and then hence we have gestational diabetes. So these women are typically treated with diet, exercise, possibly medications, possibly insulin. As you can imagine, at the 26th week of 40-week pregnancy, physicians, providers, nutrition professionals, they don't want to mess around. We don't have a lot of time to get these numbers normal. So oftentimes we'll try diet and exercise for a week. If that's not bringing the blood sugar numbers down adequately, then we'll add some medications. What are our risk factors for type 2 diabetes? You'll see first degree relative with diabetes, and that's type 1 or type 2, or somebody that had a history of gestational diabetes, or someone delivering a baby greater than 9 pounds. And let's talk about that. Why is having a baby greater than 9 pounds a risk? Well, aside from families that are very large, someone that has a 9-pound baby, it's probably a good indicator that they had some sort of insulin resistance during that pregnancy. As you can imagine, if the blood sugar is high, it's going right to baby, and baby's getting nice and chubby in there because it's getting that main line of glucose. So oftentimes, then we'll have a larger baby. And the risk is complications during pregnancy and birth, and then possibly needing a C-section because of how large the child is. Over age 45, being obese, being sedentary, those ethnicities we talked about, and then heart disease. We hear a lot about type 1 and type 2 diabetes and the differences, but let's talk about the similarities. They both have the potential for high blood sugar if not treated. Both have potential for the patient developing heart disease, and we have long-term complications in uncontrolled or poorly controlled diabetes, with kidney disease, nerve disease, circulation in hands and feet and toes, heart, eyes, sexual organs as well. So our goal for diabetes management, regardless of the type, is to maintain as near normal blood glucose level. And we're going to meet that goal by looking at food, exercise, and then, like I said, possibly medication. We'll talk about hypoglycemia and its treatment. We talked a little bit about that already when we were talking about fats. We'll get to that slide shortly. There are several different types of insulin that are on the market for individuals with both type 1 and type 2 that are requiring insulin. There's inhaled insulin, there's insulin pumps, there's continuous glucose management systems, and then injectable insulin. And then there's also several types of oral medications that can be prescribed to our patients that have type 2 or gestational diabetes. The oral glucose agents aren't going to help with type 1 diabetes because recall, they need insulin to live. So we have yet to have a oral insulin available. Now, we talked shortly before about the diagnosis test, hemoglobin A1C. Okay, this is a glucose test, and it basically measures the average blood sugar for the last 2 to 3 months. So really, it's the amount of glucose that attaches to that hemoglobin molecule, and the more glucose that's saturated that molecule, the poorer the control that has occurred over the last 2 to 3 months. So this chart shows an A1C result of 6.8. That correlates with an